You are watching KUTV Primetime News with Mutegi K. Martin. And Vivian Wangeshi is still here with me. And joining us right now is Professor Mungai Ngugi, who is a consultant surgeon and urologist, to talk to us about men's health. And June being Men's Health Awareness Month, we're here to remind men to get tested for various diseases that they might have, and of course get treated so that we can avoid many men dying premature deaths. Now joining us is Professor Mungai Ngugi, who will be talking to us more about men's health. We started this conversation on the 11th of June, and now we are ending it today on the 24th of June to make sure that we get to understand what our men need to do to make sure that we have strong and responsible men in our society. And responsibility begins by taking care of your own self and your own body. Karibu sana, Professor Mungai, if you can hear me.
Thank you very much. I hear you very well.
All right, it's good to see you this evening. And just as we kickstart this particular conversation, I want to begin with looking at what could be affecting men without their knowledge. And as a surgeon, you have operated on many patients and discovered many problems, and even counted and helped treat many problems that both men and women have. And in a special case of men today, in the internal organs, and now you have looked at the male human body. What are some of the things you have discovered in terms of ailment that are alarming in that particular regard?
Thank you very much. Now, men are also human beings, and they are like everybody else, but men are peculiar in certain ways. One, a man is, when born, is taught how to be strong, or the society expects them to be strong, never to fall ill, to always be able to solve people's problems except their own. Now, that is the challenge that you will have for men. The first challenge you will have for men is you will not find them having what we call health-seeking behavior. So the health-seeking behavior is a particular challenge for men without knowing that they have diseases. As a young person, the men are taken by their mothers for clinics, and they after that, when they grow up, when they have reached puberty, they are not as girls are. They are not shown what happens in real life. A girl will start having periods, and because of having periods, she'll be told, take care of men. Make sure you do not interact with men very much. But that becomes the first challenge for the boys, because they have to fight it out for the girls. Now, a boy is going to be chased around, and sometimes in this process of chasing girls around, you find young men start getting infectious diseases, and particularly sexually transmitted. Diseases. That's one of the biggest problems. That challenge. Yes, and somebody was saying, yes, they may not seek help, and when they do not seek help, this can lead to problems of blockage of the urethra that may have long-term consequences. These are things we call strictures. They're very common in young men, and this may have long-term consequences for men, may lead to obstruction to urinary outflow, and may even lead to kidney failure and even death. So the development of urethral strictures is a common problem. And these strictures can also happen because of the trauma to the urethra, and young men tend to climb trees, fall from heights, in this macho way of doing things, and again, you find them falling, being injured in the perineum, developing strictures. So that's a big problem that we need to look for in boys, and probably protect boys from having this kind of problem. The other problem is things that they may have been born with earlier on. The young men may have been born with areas of the urethra opening in the wrong places, the so-called hypospadias, but we also have epispadias, the disorders of male sexual differentiation. And if this is not observed by their parents, again, they would lead to some issues of how they perceive themselves, and even probably functionally of inability to have sex or even to pass urine properly. Mm-hmm. The other thing that may happen to these young men, and this is particularly important because we lose it in schools. Boys of between the ages of 14 to 20 may develop what we call testicular torsion. And in testicular torsion, the testis turns around and twists on itself, and the testis is lost within a few hours, maximum of 24 hours, that testis is lost. The young boy may not complain of testicular pain, and so or he may be ignored. And what you see in secondary schools, these young men in secondary schools are accused of having sexually transmitted illnesses, or they are kept in the school compound for the whole weekend or for the whole week, only for them to report to us with a testis which has already died, and there is not much we can do, because these boys need to have been brought to us within 2 to 3 hours of the onset of this problem. This is particularly big problem in boys in boarding schools, because the boys in boarding schools may go and see the dresser or the nurse in the school and not realizing this problem, you may end up losing the testis. Mm-hmm. Now, if you lose the testis and then subsequently you went to a doctor who gives you some painkillers, and the testis, you think it is sorted out, it shrinks, initially it gets swollen, then shrinks, it becomes a small thing. Then the next time, because it may happen to the opposite side. When it happens to the opposite side, the testis again undergoes the same phenomenon, and you will find that this boy will therefore not have any testes at all. I would ask boys themselves, if you have testicular pain, you must be seen in a hospital where there is somebody who is able to understand what is happening. Mm-hmm. And sometimes it is even some doctors who do not take this seriously and give you antibiotics, and what you have is something that is a surgical emergency that must be treated immediately. So these boys need to be taken care of, and we see this almost on a weekly basis or on a daily basis, particularly those boys who are in secondary schools. Mm-hmm. Sometimes they may be at home and the mother doesn't understand, or the father doesn't understand, and the boy doesn't complain hard enough. So he stays, you find a mother bringing you the boy 2 or 3 days after the onset of this testicular torsion, and you have really lost that testis. Worse is in situation where a previous one was lost, and you are now losing it for the second time. So the community needs to understand that boys complaining of pain in the testes mm-hmm. must be seen within, even during this time of curfew, they must be taken to the hospital as soon as possible. So I hope that that message is passed on to everyone. Sometimes they are in a place where they could have sought help, and if the doctor doesn't recognize it, it is best to, if the pain continues and you're being given antibiotics, please, these children should be taken to somebody who understands. Our salvage rate in our public hospitals is less than 10%. Less than the 10% of the people present at the time when they should have, because nobody recognizes this as a problem. And the fathers tell boys to be man enough, or their mothers or their cousins and so on. So that's mm-hmm. an important thing that we should be able to identify for boys.
All right.
Along the same thing, that the next thing that we need to think about happening, particularly amongst university students, mm-hmm. is when the boys get involved, or the young men, therefore that time they're no longer boys, they are young men, mm-hmm. and they get involved in sexual activities or pressure mm-hmm. for sexual activity by, can you hear me? Still hear me?
I can hear you. Go on.
Yes, mm-hmm. yes. The boys get involved and they want to use a drug that would enhance their sexual activity. Mm-hmm. So people use the drug that we call PDE5 inhibitors. And you find that now the boys having used this, or these young men having used this, find they cannot function without using these drugs. And later on, sexual activity becomes a big problem for them when they get married. So the use of these drugs for purposes of enhancing your sexual activity is discouraged and must not be used by men who don't really need it. If there is an adequate erection, there is no point of trying to enhance it. In these days of internet, people get cheated on all sorts of things. They get told that there are things to enhance your erection. Sometimes the perception of these young men of themselves is eroded by what they see on the internet. And these men, and sometimes in parts of our world, or even particularly in Nairobi, people are looking for a man who has a lot of money, who is has many degrees, and who is an animal in bed. And that combination doesn't exist in real life. And it is just an imagination that is supposed to in the internet, making people think that they should perform extra. And again, you find the discussion amongst men on sexual performance is that of describing how good they are at sexual performance, but really they are crying for help. And one of the things I say I used to do a long time ago, for the time I've been a urologist, is when I come across men who boast of their sexual prowess, I ask them to come and see me, because the opposite is actually the truth. They are probably having issues that need to be sorted. So erectile dysfunction is a big problem amongst this age group. Then there are people who have what we call premature ejaculation, so that the sexual performance is affected by the ejaculating within less than 2 minutes of starting the act. Again, these are people who need help. This is something that people will not often describe or talk about. It will probably be brought out by their girlfriends or their wives if they are newly married, and this can wreck marriages and lead to unnecessary quarrels in the marriage. So the young man in that situation gets into the problems that we are talking about, sexual problems. And again, in the same group, you can also get trauma. People will drive cars at impossible speeds on our roads. They get injured, they get urethral injuries, they get kidney injuries, but particularly urethral injuries are common with consequent urethral strictures. And this may even lead to kidney failure, like we mentioned. Of course, this man needs to be counseled on avoiding some of the accidents. People should be told to avoid some of these accidents, because it is possible to avoid accidents by driving slowly, by driving at the prescribed speeds on our roads, and don't drink and drive. If people drink and drive, they end up with these very bad injuries. So that's some of the earlier problems you get in the young man.
All right, now, Professor, just allow me to cut you short a bit. As you continue to talk about this, and I'm loving, we're already past half the time we're supposed to be here for this particular discussion, but I'm loving the fact that you're really bringing out the issues that you find right hand is even as you continue to do this particular work. And I'm glad this we have gone the direction of the male reproductive health system, which many men are shy to talk about. Allow me to bring in the issue of low fertility, which also faces a number of men in the country and beyond. And some of these men end up throwing the blame to their female counterparts and saying that, you know, I'm a strong African man, I cannot have a problem. And I'm going to combine this question with another one where, you know, according to one Matthew Hoffman, a family doctor, he says out of the 15 leading causes of death, men are leading in these all diseases. And one of the factors he attributes to it is the fact that men rarely go to hospitals for checkup. This issue of men beating their chest and saying that we are okay, we don't need checkup, everything is okay with us. How do we fight this problem? From your perspective, do men really come to your place, or do they come when it's too late?
They come, the majority of the times men come when it's too late. You find somebody like I had just a few weeks ago, a young prisons officer who was injured in his urethra, and he just stayed with it, tried to push the urine as hard as he could, and he couldn't pass urine until his kidneys were failing. We first had to take him through dialysis before we could surgically correct his stricture. When he would have come at the time when he was injured, he didn't need to have been afraid. He hadn't done anything unusually wrong. It's just because he was... But men generally do not know how to seek health behavior. They don't have health-seeking behavior because they think the health-seeking behavior is cowardice. I see men who come to see us at the age of 75 and the man is coming with something that will kill him soon, but he's priding with the fact that he has never been to see a doctor in his life. Of course, he's been deteriorating as he did so. So the one thing we need is to educate our men to go for checkups. Go to your medical officer in the nearest clinic or your family doctor. Be evaluated at least once a year. We're talking about the young men here. We haven't even reached the other age group. Now, you've talked about the fertility issues.
Yes.
Fertility issues are contributed to men as well as women. But, you will find many of these men will have thrown out one girl after the other in marriage, imagining that the girls must be the problem. And they're even encouraged by their parents and their relatives to ditch out these girls because the lack of fertility is assumed to be that of a woman. Of course it is not. 50% of the times it is a man issue. And we are getting more and more of these problems because of the use of drugs. The abuse of drugs can contribute to poor sperm health. Particularly the use of steroids, and a lot of people. This is sad because people go to the gyms and such other places, and they are advised to take drugs which are actually testosterone. The androgens make your muscles look very big, but those testosterones will also destroy your fertility, and they shouldn't be taken, which is why you see the International Olympic Committee trying to discourage people using such drugs. That will affect your fertility. People can think they have very good and big muscles, but fertility-wise, they are poor. They might even be good in bed, but they have lost their ability to reproduce. What God gave you is enough. Do not add those that you can exercise. That is good enough. You can trick yourself through whatever exercise, but do not add drugs. And here the gym instructors are part of the problem when they add drugs to these young men, and men who didn't initially have a problem end up with a problem because they wanted to look big. Of course, a man does want to look big. He wants to exercise, and the more exercise under the influence of these androgens, the bigger he looks. But sexually, he may also be good, but in terms of sperms, it will be zero. Sometimes people go to seek help from people who do not understand the role of testosterone, and they go there because of fertility issues. And then some of these people, when you check the hormone levels, you find that testosterone is low. Now, if you add testosterone to these men who have low testosterone, whatever little sperms they had will disappear, unless you're giving them this plus the hormones that come from the anterior pituitary to help maintain the testes. So the use of these drugs has been a very big problem. And when men are not fertile, they start feeling bad. And you find in the 30s, the one we were talking about earlier are the men in their 20s. In the 30s, we have a very big suicide rate amongst men because of poor self-esteem, getting depression, thinking that they should have been bigger than they are, thinking that their sexual organs should have been bigger than it is. And you find every time men asking for their sexual organs to be made bigger. And we have a big conversation trying to tell them, your sexual organ is actually better than most of the others. There is no need to try and think that you should enhance the size of your organ. All these are challenges that men have because they have had very little discussion with other people. They've had very little opportunities to see men with sexual organs, and so they imagine themselves to be poor. So self-esteem is a very big challenge in our part of the world. Yeah, so something like that. Yeah, thank you.
All right, Professor. Allow me to cut you short again as we only have a minute, and I want to ask you this question before we go out. As we stretch out to general health, in 30 seconds, kindly tell us, why is COVID-19 seemingly hitting men more than women? And also, as we wind up, also, what advice can you give men in terms of their medical life and their lifestyle in general to take care of themselves to avoid this kind of scenarios that we are seeing? Kindly, shortly.
Starting with COVID-19, COVID-19 is a bad illness, it's virus, but the challenge that men have is that they wait until they're very, very sick. I have a patient who came to my office yesterday. He's a relative of mine. He refused to get treated until now he's in ICU. Men don't want to go and be seen early enough for these things to be sorted out. That which would have been sorted out very easily ends up taking them to the intensive care unit. The other thing is, of course, that men move around more. They go to crowded places. They go to places where the COVID-19 is going to be spread. So if you go to any bar today, and I'm sure there are many bars which are open despite the COVID guidelines, you will find many young men seated there spreading COVID amongst themselves. So the fact that they do not seek help in good time, there are even men who are refusing to take the vaccine, even those in the health sector. This contributes to very high incidence of COVID-19 and COVID-19 complications because the men do not seek help in good time.
Okay. All right. Thank you so much, Professor Mungai Ngugi. Sadly, our time was not enough for us to particularly comprehensively cover this, but we shall be sure to contact you later and, of course, continue having this discussion as we help our men get tested. Thank you so much for joining us tonight.
Thanks a lot and good evening.
All right. Thank you so much. That was and remains to be Professor Mungai Ngugi, consultant surgeon and urologist, very knowledgeable in the area of urology, telling us on the diseases that affect men, specifically on the reproductive health. We'll now take a short break. We'll be right back with sports news. Don't go anywhere.